Before we jump in, I want to more formally introduce our speakers, find out a little bit about you, who's attending our webinar today, and then we'll jump right in. So Brian Castrucci is the President and Chief Executive Officer at the Beaumont Foundation. He has a lot of related experience in public health, including working in state and local health departments in Philadelphia, Texas, and Georgia. He has a doctorate in public health leadership from the Gilling School of Global Public Health at UNC. And during his tenure, the foundation has really become a leading voice in health philanthropy and public health practice. Dr. Michael Fraser serves, at least for the next week and a half, as the Chief Executive Officer of the Association of State and Territorial Health Officials. He is a published author of many papers and books, has previously led other medical societies and public health associations, including the Association of Maternal and Child Health Programs. He has a doctorate and master's in sociology from the University of Massachusetts and a master's in management from Michigan State. So first, let me say congratulations on the book. I know it was a long time coming and no small pandemic in the middle of writing and production. Let's find out a little bit about our attendees. If we could start our poll.
Well, and I just want to say thank you, Amber, and the team for setting this up. It's really nice to have the chance to talk about this book because, as you mentioned, we actually started it before the pandemic, and like so many things, it was interrupted. But we continued, and finally were able to get that finished. And you yourself have some contributions in the book, so thank you for that.
Thank you. While we are getting our poll started, why don't we jump in a little bit? I'd love to hear a little bit, Mike, first. Can you tell me about the motivation behind developing the book?
Well, you know, we've had the strategic skills for some time, thanks to Brian's leadership and vision, and the Public Health Workforce Consortium that vetted and created the strategic skills. And actually, the strategic skills are part of the training mandate for public health training centers. And so there's been a lot of work in this area, a lot of great work in this area. I don't remember time very well post COVID, but at some point in the last couple of years, the strategic skills were updated. Not a lot changed, but there were a few changes. And that was a good time to say, well, what else do we need to do with these? And what we heard from folks is some kind of easy read, and it is a pretty easy read, on what the strategic skills are, how they're created, and what they mean for public health practice would be a very helpful tool to include in both the training center's work as well as the work of our professional association and partners. So the need was there in the sense that folks want an easy to find one-stop shop for strategic skills and explanations of those. And in addition, and Brian can talk more about this as well, we're also editing a set of 9 primers, short volumes. I don't have one on my desk, but there have been 2 published so far that goes into a little more depth on each of the strategic skills more specifically.
Thanks for sharing that. And I see we've got our poll started. So our first question for attendees is how familiar are you with the strategic skills for public health practice? And it sounds like the majority of you have not heard of them before. So we're glad you're here and have an opportunity to learn more. Brian, why don't we stop here and tell us a little bit more about what are these strategic skills and how were they identified?
Thanks, Amber. I mean, this is great. I like that more than half of the folks here haven't heard of them, and that's a good step for us to share this, because what I want to, when you think about public health, okay, we have amazing scientists in public health, but what we need are those wraparound skills, those skills that allow us to bring our science to other people, that allow us to have effectiveness with our work. When you think about a restaurant and you have maybe the best chef ever, but there's no wait staff, you're never actually going to get your food, no matter how good that chef is. So the strategic skills are like the wait staff in a restaurant. They're bringing all the good stuff that we're cooking up in public health and bringing it right to the people who need it. And so we have 9 strategic skills, everything from effective communication, database decision-making, cross-sectoral partnerships, systems thinking, community engagement, change management, policy engagement, and justice, equity, diversity, and inclusion. And so what these skills, when you think about a complete public health worker, you have all of this scientific knowledge, you have all of these abilities that we've gained through our training and through our practice. But then it's about how does that actually get transmitted? And so resource management is just like one example. Listen, we all have great ideas in public health, but how do you have the resources to implement those good ideas? Are you thinking about everything? You know, even when I was in practice before joining the Beaumont Foundation, you know, folks would say, oh, well, we'll do a webinar, we'll do a health fair. And you'd say, well, how are you paying for the health fair? It's like, oh, it just happens. Like, no, nothing just happens. Everything has a cost to it. And now, so think about this from a resource management perspective. We are in a time of major inflation. So every single budget we have has been cut, not from the funder, but from the expense side. So what $100 worth of gas cards got you last year, you don't get quite as far in it this year. And those are the dynamic skills that we need to be thinking about. Like when you run a Title X program, of course, your goal is to get women the best family planning care you can. But God, the costs of the units, the cost of rent, how many people you're seeing per client, costs of staff, you know, the process of how you get an appointment to when you actually get seen. These are all the logistics that strategic skills encompasses. And I think that's why they're really important.
Thanks, Brian. Do you think then that the strategic skills are more relevant to somebody who's new to the field or more experienced? And let's go to the next question as well.
Well, I think they're relevant to everybody. I mean, I think people who have been in the field for a long time have learned a lot of these skills and have the scars from the learning. Mike and I could both kind of like show you this scar was when I made that mistake. This scar is when I made this mistake. So we've learned by our own mismanagement and missteps throughout the way. But I think it's really important for people who are new to the field to have these skills because, I think we all know people who were unsuccessful in their jobs, not because they were bad scientists or because they didn't know public health, but because they didn't do well something they were never trained to do. And
Yeah,
so these are the things we have to do. And this is what we need to get into our workforce.
I think that's a really important point, Brian. I mean, the training that most folks receive in their jobs by and large is probably on the job training. And within health departments, we know there's an emphasis on workforce development, but it may be more technical acumen versus some of these strategic skill areas. So it's really important for both new and more seasoned folks to expand that skill set, moving beyond maybe how they identify in a programmatic category or how they identify professionally in an area of specialty, towards these strategic skills that are much more horizontal, can be applied across the agency. I think it's really important for folks who are seasoned managers to look at this because there is an evidence base to leadership, and a lot of that's in the book. As well as new folks who might be considering leadership or being considered for managerial or leadership positions, because you could go in to that process saying, you've learned this, have these skill sets, and that's one of the reasons we have them is to help prepare better, prepare public health leaders for new management roles. The book itself is not organized by the 9 strategic skills. It's a collection of different chapters that are pieces of that. And that's another reason why we also will have this primer series to delve more deeply into the particular individual strategic skills.
It looks like of our attendees, systems and strategic thinking is coming up on top.
Oh, that's so good. I just finished that primer, literally. Well, that's great to see. I'm very enthusiastic about that.
If you can scroll down to the bottom again, so we can look at, so we're seeing that policy engagement, community engagement, and resource management, justice, equity, diversity, and inclusion are kind of at the bottom of the list. Any of these findings surprise you, at least among the attendees here today?
Well, I'm not going to read too much into it because I think it's pretty anecdotal in terms of where people are putting their votes, if you will. But it'd be hard to say one of these is more important than the other. I think it depends on where you are today in terms of your thinking. and maybe what you're facing at work right now. So certainly, where I think folks want to spend time at the top, we know that from Public Health Wins data. We know from what the public health workforce has told us more broadly over time that the strategic skills specific to resource strategy and systems thinking and communications are high on the list. These other ones are equally important, but also get a lot of other airtime in public health. So that might be what we're seeing in real time here.
I don't think I could pick among my children. This is my daughter.
Yeah.
Which of your kids are, which of us is your favorite?
Our participants may be feeling the same pressure.
Yeah. And I mean, all of these are so important. I mean, when you look at something like resource management, we have more money in public health right now than we probably expected in the 107 or so grantees who received FIG money. But how are you spending that? How is that money getting used? Is it being used effectively? Is it being used for something that we only do today? Or is it something that's really going to give us long-term change, right? Again, I'm in the philanthropy space and I see philanthropy is not doing a particularly good job of resource management because it's like, well, let's feed 5 people tonight. And that's great. We should feed those people. That'll help those people. But what about the 10 other people tonight? What about those 5 people tomorrow? And that's where like resource management then gets in with strategic thinking, because what we really need to do is solve the problem, not just kind of mitigate the effects of that one day. And so what strategic skills really lets you do is, I don't know about you guys, I've been in public health for longer than I'd like to think. I think I got my first public health job, when I was like 20 years old. So this is 30 years. And I look super good for my age, I know. But
I didn't realize you were 50, Brian.
I was 50 in May. You can all send your cards to Brian Castrucci at Beaumont.com. I've always felt like I'm on a hamster wheel, right? Like we're doing the work and then we got to do more of the work and more of the work and more of the work. What strategic skills does is it's really a way to break the wheel, right? It's a way to take what we know works and make it more systemic. And so we need each of these skills. When you have all 9 pieces, that's when you've hit a point of being a complete practitioner. And unfortunately, the schools of public health aren't training us to do this kind of work. They're teaching us the science. And so what we really need is, as a practitioner community, to develop these amongst ourselves through mentoring, through other trainings. This is what we need to achieve the outcomes we want and not just continue to be on that same hamster wheel.
So it sounds like folks in the chat agree that there is no picking amongst children, and also that the way that the question is worded is really about what do they want to hone most this year. So certainly doesn't necessarily reflect a priority amongst these topics. I do wonder, Brian, in thinking about the role that we see in public health wins, for example, that many who come to state and local governmental public health do not have academic training in public health. Do you see that as contributing to the workforce challenges that we're seeing in the country?
I've worked with a lot of different people in public health, and I think it's one of the most beautiful things in public health is it takes a lot of different people to make public health work. I am a trained public health scientist with a DrPH in public health leadership and a master's in socio-medical sciences. I did that path. But I remember in a previous job where I was sent out into the community to do some engagement while another one of my colleagues was back writing a grant. And, it wasn't my community. I probably wasn't the best representative. And she didn't want to write that grant anymore than like do anything. She hated writing. And I was like, wait a second, let's switch this for a second, right? She brought an amazing viewpoint into the community, and I can write a grant with my eyes closed. So it takes a full kind of every kind of person to make public health work. And so I would never be one to say that public health is only for those people who go to a school of public health, right? No one owns public health. We all own it. And so the more that we can think about public health is like, maybe I'm the peanut butter and a community health worker is the chocolate. And when we put us together, we are a Reese's. And a Reese's is a whole lot better than just the chocolate or just the peanut butter. That's the beauty of public health. The challenge is when we swing the pendulum too far either way, and it's all just community voice or it's all just academic voice, it doesn't serve our purpose.
Thanks for that. Let's go to our next poll question. So this is getting to what about professional development is most important to you. So while our attendees think about that a little, something that has come up already is that you might need different skills at different times in your career. And I want to talk specifically about a time that we all just experienced collectively, and that is the COVID-19 pandemic. Do you think that has changed anything about these strategic skills, the need for them, the importance? Any thoughts on how COVID has impacted the strategic skills?
Well, I think, broadly speaking, the challenges we faced in COVID were initially technical, like what is this virus? How does it work? But as the pandemic grew and we got a better handle on the technical side, what I witnessed from my vantage point, which was working nationally with all the states and being in Washington and liaisoning with federal government and lots of partners, was that it was actually some of the management and strategic issues that were the toughest about COVID. And those, really heightened how important the strategic skills are in terms of communication, for example, in terms of resource management, for example, in terms of strategy. What was our strategy and how does that work when you've got 59 states and island jurisdictions and territories making, different policies? How do you get involved in policy? And of course, how do we put equity at the center of all of that? So there was definitely a lot of lessons in the COVID experience, well beyond how any public health scientists would be able to respond, but certainly presented leadership and pretty obvious leadership and management challenges, which are inherently strategic. And so I think it really illustrated how important they are and how to complement the public health workforce's specialty knowledge, how important they are to build the strategic thinking competency across the public health workforce.
Yeah, I think the COVID pandemic put an exclamation point on the need for this. And listen, gang, I don't want to say that COVID was easy for us. It was really hard. We were bullied, we were harassed. That's all true. But we have to own some of the challenges that came in COVID. When I went to get my vaccination in Maryland, it was done at the Maryland Fairgrounds. And so I had to drive an hour to then wait in a line, to then have childcare, to have a day off from work to do it. All of those things fit into systems thinking. It's not where we were very successful. And when you really think about communication, which is something I'm, really dedicated to, effective communication, we have the Public Health Communications Collaborative. If you've not heard of that, I suggest you Google it, because I'm right with you on the challenges of misinformation. But I have to ask how we in public health tilled the soil where misinformation grew because our communication wasn't effective. And I'm sorry, Tony Fauci did say, we don't need to wear a mask. And then he changed it. At first we told people, come on, you all remember when we had to clean our groceries? And I remember Sanjay Gupta on CNN, this is how you clean the apple. And this is how you do this. And we didn't get our mail because we thought that was going to and then we learned that didn't do anything. And we never went back to the American public and said, hey, let me tell you, you can stop doing this. Go ahead and get your mail. Because we spoke with certainty when we had none. And that really undid a lot of the trust that people had in public health. So again, I'm not here to criticize what we've done, but I am also not a public health apologist. And I think we can learn a lot from this past pandemic so that in the future, we are better in delivering the life-saving care that people need, right? So, I mean, what we can do better, we can understand the resources, we can understand systems, we can communicate more effectively. We had people during the pandemic actually say, I wonder why people of color don't trust the medical system. I mean, we're here to help. Really? You don't know? Crack a book. And so we were in that point, trying to figure out the legacy of Tuskegee and institutional racism in medicine like it was a new thing we just discovered. We can't do that again. That's why you need strategic skills.
Thanks, Brian. It looks in our poll like most are interested from an aspect of, becoming more adept at their jobs, but there is a piece around finding new opportunities and also, increasing salary, which we know has been a pain point also in the Public Health Win survey for a long time around pay in government. I wonder your thoughts, maybe Mike, we can start with you this time. Do you think, honing strategic skills are a way for public health workers to advance in their careers?
Well, I think so. I mean, for those folks who are interested in pursuing leadership and management opportunities in their agencies or, furthering where they are right now, I think this knowledge of the strategic skills will help a lot in dealing with, again, some of the challenges that are more people-oriented or strategy-oriented than technical. And so certainly being able to say, you've done this work and acquired this knowledge, it's going to position you well for future opportunities. One of the things we want to do, which we're still figuring out how to do, is provide actual training in these. So you'd be able to have some kind of badge or certificate based on the strategic skills. It's our hope we'll be able to do that. We're still working out the logistics of that. But again, this book would be a text for that, as well as some other materials that have been developed.
So let me put a different spin on this. If you are listening to this webinar and you know a younger person in public health, buy them this book and give it to them for, I guess, St. Patrick's Day is the next upcoming holiday. Like, give it to them for St. Patrick's Day. It should be their St. Patrick's Day gift. Because this is the differentiator, right? When you're coming out of a school of public health, or you have this, deep scientific knowledge or experience from, your lived experience, any of that kind of knowledge that you have, this unlocks that. And so when you look at graduating from schools of public health, there are a lot of people who do that. We produce a lot of MPHs every year. And the question is, what is the differentiator? And it's someone who can do this kind of work, who can think and mobilize that knowledge into kind of effectiveness. And so that's, I think this is, as I look back on my career, things that I was fortunate to just kind of be able to do, like, how do you manage a grant budget? How do you write a grant budget? There are folks who don't even want to hear about the budget. They're just there to deliver the service. But, there, as we have heard often in our training, there is no mission without margin. And so this set of skills, it's like the oil in an engine. The best engine in the whole world will seize if there's no oil. This is the oil of your career. It'll keep it moving forward, right? Because you're going to be in the room and go, hey, let me tell you how to do that. Not what's the right medication or what's the right dosage, because that I can look that up. But how do I get people to engage in this conversation? How do I mobilize we have partnerships, right, as one of the strategic skills. And guys, I'm not talking about all the partners that agree with you. I'm talking about the partners that you don't know or even don't like. That business community group that you've never really talked to. And sometimes you're even their regulatory agency, but you got to reach out to them. Think about this. Americans don't trust government and they don't trust media, but Americans trust their employer. We didn't mobilize employers to be delivering messages about COVID and about the vaccine and about masking. CEOs should have been sending messages through their email chains at every business in this whole country, but we didn't know them. We didn't take the time pre-pandemic to make those partnerships and have those relationships. No one listens to us, and that's fine. I don't need anyone to listen to me. I want to get a set of messages that I can send to Megan the Stallion, and I can sign it, Brian the Public Health CEO. And I want her to push out our messages because people listen to her. They don't listen to me. And so we got to figure out how to leverage those things.
Thanks. I look forward to seeing Megan the Stallion coming out with some public health messages. I think that would be very effective.
She's getting there with the Planet Fitness, I think.
Yeah, exactly. So earlier in the chat, I was intrigued by a comment. Someone who mentioned that some people, such as those who are in the data sciences, might struggle more with some of the strategic skills. And specifically, I think they mentioned strategic and systems thinking, given their much more detail-oriented point of view. Do you think these skills are accessible to anyone? And what would you recommend if someone's thinking that maybe these aren't in their natural wheelhouse?
Well, I think they're accessible to everyone. I think it's important for everyone to learn a little bit about all of this, especially if you're working in a large organization where there's lots of different pieces. I mean, at the core, public health will always need technical experts, whether it's an epidemiologist or a very skilled administrator or and anybody in between. But there are some things we all need to know how to do, and I think that's the point, that we haven't emphasized those as much as we've emphasized the differences. And so, this strategic skills for better health could be strategic skills for better manufacturing. I mean, they're pretty universal. We just wanted to put them in the context of public health because we know in our community, there's so many folks struggling to develop their leadership and management acumen. And that's not something that a lot of us get. And so we do learn on the job, and we are promoted for tenure. And in lots of places, that doesn't mean necessarily a lot about strategy and strategic thinking or communications or justice, equity, and inclusion, or all those other things. And so I think it's important, again, to kind of round out. And Brian, I'd love you to talk about the T, because I think for lots of people, that, especially me, that's graphically how I understand why this is so important.
Yeah, so when you think about a complete employee, you should think more about like a T employee, right? Like the letter. And that vertical line in the T, the base of the T, that's all your science, right? That's what you know, and you know it deep. But then you have the crossbar, right? The horizontal line. And that's you moving across different groups and having those skills that allow you to bring things to people. And when you're looking about the question about someone who's into data science, and I mean, that's important. We need data scientists, right? Huge data modernization initiative. When you talk to the data scientists, they start talking about, this server and that thing and this fancy language. And you know what they don't talk about? They don't talk about data justice, right? We want to focus on and center health equity, but where is that conversation about data justice? Because data are the original sin, right? Any bias that you bake into data, then that bias amplifies as you go forward, and you're making policy decisions based on that, based on those biased data. And so that's why someone who's in data would need systems thinking and would need JEDI, justice, equity, diversity, and inclusion. I mean, that's really important, right? For that kind of worker. And someone in the chat said something that people trust their churches. And that's such a really important point. But listen, we were all listening to certain people in certain churches say things like, well, you do you, right? I'm not quite sure where that is in the Bible, like, Peter 5:20, and Jesus said, everyone, you do you. Like, it is antithetical to every religious practice there is, but that's what people were saying. And we didn't cultivate those relationships and those partnerships with church leaders to say, can you put this message in the newsletter, in your sermon, from wherever you're preaching? It is so important. So everything that we look back on, that we maybe fell short of in the pandemic, I think in a lot of ways could be addressed by embracing and implementing a strategic skills framework today, right? Y'all know, a politician has never asked us about an odds ratio. They've asked us about, like, how does this work? How does it impact my constituents? And those of us who know how to answer those questions and can do it well, we then build political capital with those elected leaders. Those of us who want to quote odds ratios and debate the size of the confidence interval, we're not going to make the change that we want.
Well, you never know where Brian's going to go. That's one of the challenges of working with Brian. But, I think that's a fair point in terms of using the strategic skills to really round out the expertise that public health professionals have, and to sharpen some of the tools that may be a little dull, but also to expose folks to the fact, and again, I think this is an important point, especially for folks who may be really interested in learning and not have had the opportunity or face barriers to getting, further degrees in management or leadership. There's a lot of evidence out there. There's a lot of great thinking out there. Most of what we wrote about in the book is pretty basic management and organizational behavior, but it doesn't reach a lot of the folks that we work with for lots of different reasons. And so we just wanted to make that content accessible. I think about my own biography in regards to this. I mean, I was trained as a sociologist and all kinds of social science methods and content. And I went primarily to work in associations, so it's not the same as a health department, but I wasn't, formally trained in management, and I was leading people, and I wasn't formally trained in strategy, and yet I was facilitating conversations with leaders and boards of directors, and I was managing grants, and that's all on the job, and that's great. But when I went back, I had the opportunity, fortunately, to go back and get a master's in management and leadership. I realized there was an entire evidence base, and I was doing some things, I could do some things better if I knew what that evidence base was. And so it's sort of that mindset that we bring to this work, that are things we can do better. We all know that. And we wanted to make that accessible to folks. This is not the replacement for getting an MBA, but it's a place to start if you're interested in how to, take some of those concepts and apply them to the business side of the work.
Well, let's
Mike
talk
is
about businesses.
add on to that, Amber, because Mike is
Right.
super right there. Like we went into this work and we get trained in our schools to do science, but the Title V grant in Texas is like a $50 million grant, or the Title X grant is like a $20 million grant in a different state. Like, we're talking about, sizes of grants that are bigger than some businesses. And most of us can graduate nursing school, medical school, public health school, never having a real course in budgeting. And yet you then get to the health department and like, here's your first grant. And you're like, well, I know how to do the content, but how do I hire somebody? How do I write interview questions? How do I write the budget? What's a DUNS number? I still don't know that. I've been doing this. I know what my DUNS number was. I don't really know what it is. And it's like, I guess I need to know these things, but none of that is taught to us. And so we are in an under-resourced health department, and then we have to drink from a fire hose when we get there, trying to learn stuff that, it's not written down, right? And you wish there was a little book that was like, well, here's the things you need to know. This isn't the whole thing, but this book on the strategic skills really does start to get you there. Like, this is the stuff you got to think about. It's like being a whole person. It's the yin and the yang of public health. The science is the yin, all the strategic skills is the yang. And that's how you have a complete circle.
So I think one of the things that you are both bringing up here that we haven't addressed directly is, and this came up a little bit in the chat earlier too, is that here we have a real onus on the individual for their own professional development and their own career pathways. We saw during COVID that people were promoted into new positions, just given the number of positions that people were hiring for and the dramatic turnover that occurred in health departments. What about the responsibilities of health departments, of employers, in assuring that their employees have the skills that they need, both technical and strategic? What would you say to them in this moment, about how they might use these new resources, including this book, to better help prepare their workforce for the future?
Well, I've worked with many health departments, and I know the barriers that folks face, and I know training is the first thing to go when budgets get cut. But I think and again, this is part of why we need this training. The investments we make in our staff are only going to make our organizations better. And so it's sort of penny wise, pound foolish, especially for a bunch of, public health professionals that focus on prevention, to not expose staff and invest in their development. Now, there's lots of different guardrails to that. And I know folks work in government where there's a lot of constraints broadly, not just in the health department. But I would hope, and I think with many of the new resources going to states, particularly around the infrastructure grant, there's potential to support some new things. And I know there's some new positions, and every state has to have a workforce plan now. It's always been the case, part of accreditation, public health accreditation, voluntary accreditation. But maybe that's another, again, push to get folks to really be more strategic in their workforce development activities. And again, highlighting not just it's important to go to the technical conference and learn the newest techniques or the best science, but also for our staff in general to learn how to be better managers, to be better leaders, and some of the other core content in here.
Yeah, I'm a little less optimistic on that front.
Well, of course you are.
The challenge for us as a field and what we have to kind of coalesce around is that even if we do training, if you can be in one state with 10 health departments and each health department wants to develop its own training, right? We need to find a core set of skills that we need, that there is then some incentive for us to take that continuing education. Because right now, the incentive for continuing education in the public health system in the US is because you're a really good person and you want to improve your skills. We're not licensed. We don't have CEUs. If you're an epi, you graduate from epi school 100,000 years ago and never have a requirement to take a continuing education course. So why is it that in public health accreditation, there isn't a requirement to be an accredited health department? You must require some sort of continuing education. You must have you must sign on to a training plan that is endorsed nationally, right? That's what we need to have, similar skills so that you can move in between health departments, that, skills are universal. When we do our hiring for managers, unfortunately, we often are hiring people based on their technical skill and not their leadership ability. And so how many of us, and I'll say it was me, and I'll apologize to all those people early in my career when I was managing with no idea what I was doing. I was like feeling around in the dark without a flashlight. I mean, I became a manager, but I was not trained to do that. And so I wasn't particularly good at it. I think I'm better at it today. My staff who are here, maybe in the chat, might disagree exactly, but that's a lot of experience and a lot of people who had to pay a price for my training. And so why isn't there a national public health manager accreditation? Because we know that we're taking like an epi and we're taking the best epi and making that epi the manager of the epis. And then they don't do well. And we're like, oh, they weren't up for the gig. Like, no, they were up for the gig. They just, we didn't give them the right skills to lead and manage, which is a whole different thing. And again, something I've learned over multiple decades, but, people paid a price for it in my early years. So I wasn't a very good manager. I was a really good technician. I could do things with data that would blow your mind, but that management piece, no one taught me. So why did we think like I knew it? Because I was really good at data? Geez, that would like suggest why I wasn't going to be a good manager, but I learned it. So again, how do we do this so that we professionalize? When Walmart runs a new point of sale system, they don't say like, hey, all the stores, when you get around to it, you take the training on the new point of sale. Good luck with that. It is done like, this is how we're going to do it. We don't do that. We have to launch infodemiology into our public health workforce. And just the thought of doing that is such a huge challenge because there's no one button to push that gets it to everybody.
Yeah, I mean, I think that was the spirit of creating the strategic skills in the first place, if I remember correctly, that there's a body of knowledge that the field agrees is essential to everybody knowing about and learning about. And now we're at this point of, well, how do we implement that, right? And there's been a little bit in the chat. It's hard to talk and read at the same time, but to really think about how do we integrate this into some of the existing channels, but also create new channels for people to learn, channels that are free, channels that don't take a lot of time, all of those things that would have low barriers to learning, and then provide opportunities for more deeper dives. I mean, that's, I think, where you're going to see a lot of the academic programs going. Maybe there will be a grants management and public health course offered at a school of public health somewhere, and it probably is now, but more of those that you could dive more deeply into. And that, I think that would be success. Absolutely.
And the chat's fire. I mean, the chat is great. Like, this is like, we're all geeking out over public health today. And someone just wrote, like, is how do you incorporate professional development funds into a federal grant? Put in the line, put it in your indirect, put in like, okay, we're gonna, in all of our grants in our health department, we're gonna put a 3% tax on the staff line. So 3% of the staff line to create the pool for professional development in our agency. And I think that would be allowable, right? But those are the things that we have to think about. Like, we are so like hand to mouth, right? Now, let's be honest. Let's tell each other a secret. We need the money from the CDC. We need those grants, right? But they need us to take them. If we start not taking the grants, then they can't move their money out, and that's a problem for them too. So with our federal funders, with our foundation funders, with any funder, we need to be able to say, like, look, we found a way to provide fringe rates, right? And the fringe rate is your retirement and your PTO and all those things, right? So we pay for stuff that aren't direct service. We now have to figure out how to work professional development into that fringe rate, right? And it is a tax on our service, right? This is the problem that we have. Is like, well, I don't want to put that on the budget because then it means less service, right? But I'd rather less service provided by better trained staff than more service trained by people who are not qualified. And so these are the real hard conversations that we have to have as a field together.
These are great points. I remember earlier in my career, we wrote a grant to a federal agency that will not be named. And we included our professional development for staff as part of the grant. And they took it out of our budget and said, we expect that you have hired people who are competent to perform the work that you have proposed to do. So feels like there's still some education that we need to do with our funders as well about the importance of ongoing development. I wonder if we could talk a little bit about any other audiences that you intended for the book. You know, we've talked about individuals who want to take charge of their careers. We've talked about employers. Did you have anyone else in mind when you started thinking through this book?
Well, I personally thought a lot because I have been affiliated or adjuncted a couple different schools. I really thought that this would be a good book for folks in what are now bachelor's level programs and master's level programs in public health, really just depending on that core content. Because there is a huge side of public health practice that is not technically public health. It's grants management, it's budgeting, it's communication. So I also thought that the academic programs and some of the schools of public health programs in public health at all levels would benefit a lot from this. And I really do hope they pick that up. I don't know, Brian, what are you going to do about that?
Yeah, I mean, every student, both books, right? Every student in every school.
Wait a sec, this isn't for both books.
This is both books. Because these are the skills that we need. And listen, I've done more school than I like to think about. But one thing stood out in 100 years of public health training that I've had was a leadership course where we had to go on a leadership journey that was led by the professor, and it was Ed Baker's class. And man, it was good, right? Like, I think about that class every day, about what I am, what am I good at, what do I want to be, right? How do you put a team together? If you're a Marvel fan and you look at the Avengers, you might think, well, I want to be Captain America because everybody likes Captain America and he's righteous. But you know what? Sometimes you need a Hulk. Sometimes a Hulk is what gets it done. And so what are you? And you know, how do you engage with people? And what's your authentic self? Like, of every single class, the class that taught me how to do linear regression, taught by Andrea Biddle at UNC, and that class by Ed Baker, were the two most important classes I've ever had. And I wish everybody could have them. And so taking some time to figure out, how do you talk to people? I love, someone in the chat wrote, businesses need to understand the mission of public health. I would disagree with that. We have to figure out how to make public health interesting to businesses. We have to figure out what everybody else's WIFM is, what's in it for me. And our need to have, like, well, this is, you should know what public health is. No, I don't want to know what public health is. I want you to be able to tell me what the value of public health is to me. because we spend a lot of time in public health talking about we help vulnerable communities, we help the poor and underserved. Well, if I'm neither in a vulnerable community and I'm not poor and underserved, then clearly you have no value to me. Not true. Public health impacts every person in every county, in every state, throughout this nation every day. And it's one of the best ways that you can spend tax money, because if you invest in public health today, then you'll save money in education, you'll save money in healthcare, you'll save other dollars down the road. If that had been our message from jump, we'd be in a very different place in public health. We need to teach people how to be better public health people and not just to be pandering to our own constituencies. And I'll be even more controversial today. Even when we talk about justice, equity, diversity, and inclusion, let's be really clear. If you are speaking to a conservative audience and you want to talk a lot about health equity, you need a trigger warning. So you need Nikki Haley. They did a really excellent piece on NPR about Nikki Haley, how she's talking about health equity or equity, how she's gaining a better following around equity, but never using the terminology. So the terminology is triggering. We can't continue to be linguistic absolutists and say, if you don't say our words, then we can't work with you. So this is all what's in strategic skills. It's the pathway to how to get to what you want. It's like the sales manual for public health, if you will, because that's not what we thought we were coming to this job to do, be salespeople. But that's why we fail. We have to be salespeople. And this is your sales book.
Well, yeah, and I think talking health, as you raise that, is another good one. You may want to show that one again, because that's actually, there's a lot more in that specific to that issue. Beautiful book.
And they mirror each other. And that's actually, there's a whole, like, we will have other books in this series that have that same kind of branding on them. And again, Mike mentioned the books from APHA. The policy book has done extraordinarily well. It's 80 pages. And the coolest part, and this is why everybody should buy those books, because these books were not written by academics. These books are under kind of like Damon John's FUBU brand. It's for us, by us, for public health practitioners, by public health practitioners. Now, I love a good academic, but, I'd rather hear about, how to fight a military conflict by someone who's fought it and not just studied it. So, I think it's really important that we as a public health community are lifting each other up and sharing what is important to us and all the things that we've learned, and not leave it to just the people who are paid to write books. And it's one of the reasons the book took so long.
Wait, people get paid to write books?
Yeah, right. It's like part of their job. Like, we're doing all this.
We didn't do that.
Nope. It's a passion project. Because I think both Mike and Amber and me, and again, all the very cool people I'm seeing in the chat, like Mallory and Vanessa, like, we've learned this because we have the scars and we want to share that. I want to save a student from a scar. That's the point of these books, is to save them from some horrific thing that they did. When I popped off at one of my bosses when I was younger, you think, oh, I'm glad you survived that, because you really shouldn't have. And, I do it differently today. But how do you get that training? And I think it's really important.
So you're getting some converts here in the chat of people who want to come work for you, Brian. I wonder if, we've been able to, incorporate some of the chat as we've been talking, but as we close out our chat this afternoon, if there are any lingering questions for our attendees, and while you may write into the chat some questions that you may have, I just want to ask you both, is there a strategic skill that you feel like has been personally beneficial in your own career paths, or something that you really feel like made a difference in who you are as a leader and the work that you do?
Well, I think, Brian said it's hard to choose a child's, and it would be hard to choose one of them. But, I had the opportunity, I was fortunate to contribute a couple different chapters in this book, and I'm working on the systems and strategic skills. But honestly, the chapter specific to Jedi, to me, really represents a lot of growth in my leadership journey and the evolution of teams I've worked on, and was really fun to write because we all sort of say diversity is important, but when you actually look at the research and you think about what diversity brings to an organization, it's far more than, the international potluck that you have every year on whatever day, but the productivity, the insight, the significant impact that a agency can have really is related to the ability of that agency to tap the different perspectives that comprise its workforce and have those well managed to contribute to the work. So I would say, to me, that's actually had the most profound impact on how I lead, because it's something I've watched actually happen in practice. And, one of the articles that I read, and it's summarized in there a little bit, is called Enough of the Business Case Already. And I think that's really important. There is a moral imperative to the way we treat each other at work. And I think that chapter, for me, is just particularly poignant. And, again, not something that you would necessarily learn, but certainly something that's valuable to know.
Yeah, and I put my email in the chat. So I never view this as a one night stand. I view it as a first date. And so let's have a second date. And feel free to reach out to me or, or Julia Haskins. What's really interesting for me is when I look at the strategic skills and I look at the work that we've done at Beaumont. When I joined Beaumont, we were 3 people. We're now like 38. And a lot of the work is work that is now like the strategic skills are the trunk of the tree. And we've done all this work that then comes off of it. Whether it's, it's the public health communications collaborative for effective communication, or it's MADE, modernizing anti-racist data health ecosystems for justice, as another, branch, or our city health program, like that's another branch. And, it's all, this is where we got to go. And so it's not just one chapter or one skill. It's evolving as a complete person in public health means embracing these strategic skills. And I just think it's so important for the field because, the hardest thing we have to do is, I think Mike and me and you, Amber, and many people in the chat, when we were talking to groups of people, they're a little battered, they're a little beaten up, they're a little sad, they're a little depressed. This was our moment, and some really bad folks stepped on our moment and made it a really bad experience for public health. The problem is we're only at like the second inning of the 9-inning game, and we got to figure out how to dust ourselves off and get back to bat. And this will help us. We have this small window now and between, the next pandemic or the next crisis or the next whatever, where we have to be better. And that's unfair to us, but it's always been unfair to public health. So why stop now? And I think this is something we have to embrace just for our own skills and our own ability to do what we want to do. Because listen, none of us got in this gig to make money. Like everybody, no matter how much you're making here, you'd be making more somewhere else. But we chose to do this work because it speaks to our heart. It speaks to our mission. And this is what's going to let us get to that mission. It's knowing these strategic skills. It's being able to do, I wish the guy who sold me the timeshare in Cancun would come and help us promote public health. Because I just went for the knives and I ended up buying the whole timeshare. But how is that, right? Because they know how to make you, like they had made you buy a timeshare when we couldn't get you to put masks on to protect you and other people. And so that's the stuff I want. Like, that's what you think about tonight. Before you go to bed, think about that. How is it that dude got me to buy a timeshare, but I couldn't convince someone to put on a mask? And why were they able to do it better than me? And how do I get better? That's the thing to think about and talk at your next conference when you've had a frozen mudslide or a daiquiri, which are my preferred adult beverages.
So I hear this theme of how do you get better? And certainly this is a great book and tool for anyone who wants to do that, or who wants to help those who they manage in furthering their careers. We have just a minute or so left. I wonder, any final advice to our attendees? Anyone who what do you want our attendees today to walk away with? And what you'll see on our screen is a QR code, so you can get 30% off your order if you order using this code. And we hope that you'll take us up on that, because we think that this is something everyone needs. So Mike and then Brian, and we'll close out here.
Well, I think there's a lot of conversation going on both in the chat and the conversation we've had together. Thank you all for listening. And thanks again. I just want to say, for all you do in public health, you don't hear that enough. And I want to make sure you know that we at ASTO and our partners just really value the work of everybody doing this really important work out in the field. The thing I would say to take home is that this book is there. It's there. We didn't do it just to publish it. We did it so it's used. There's a lot of opportunities to share this, to do book clubs at work, to let us know how you used it and ways that you think, things you think we should do more of. There was a comment I just saw that says we should have more of these kinds of conversations in a series devoted to this. So, I mean, I think the more we can bring this to the folks we work with, bring it to leadership, absolutely the better.
What's really cool about this book is anybody can use it in a health department, right? We always get into our silos. I'm MCH, I'm HIV, I'm STD, I'm immunization. This is all of us, right? And so rarely do we find those things in public health that are greater than, the sum of our parts. We tend to be our parts. And so this is us. This is what we all have to be, no matter what you're doing or where you're going. So we're here, reach out. We can do lunch and learns at your health department. We can do whatever you want. Like, this is about a movement. And Nancy's right. Mike, you're going to be missed. Thank you for doing this with us. You're amazing. And thank you for what you've done for the field. So thank you.
Thanks for all your support, Brian. And maybe we'll do a building strategic skills for pathologists.
Well, thank you both for this afternoon. It certainly was an entertaining conversation, as it typically is with the two of you, but also energizing. I saw a lot of comments in the chat that there was a lot of really useful takeaways that people are taking with them, but also some new energy for the work. So thank you both for your vision, for really thinking about how we in practice can continue to evolve. And thank you for your leadership. We appreciate you. Have a good afternoon, everyone.
Thanks so much.
Thanks, Amber. Thanks, Mike. Thanks, everyone.
Bye-bye.